The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, thanks for joining. My name is Daniel Alex. I will be the moderator for today's webinar. We're just going to sit tight for a couple of minutes, give folks a chance to continue to log in, and we should be starting here in just a couple minutes. Thanks. Okay, well thanks everyone for joining. Again, my name is Daniel Alex, and I'll be your moderator for today's webinar, Developing Your EHR Replacement Strategy. Just a few housekeeping items here. All the lines here will be muted, so if you'd like to ask a question, just look at your GoToWebinar dialog box there and go ahead and type your question, and we'll be sure to either answer it during the presentation or we have time set aside towards the end. So definitely encourage you to go ahead and ask any questions that are on your mind. And lastly, the slide deck and the audio of this webinar will be made available afterwards. We'll get that out to you here later towards the end of the day today. So today's presenter is Brad Benson, President and CEO of eFormatics. Brad has nearly a decade of healthcare IT experience, and he has led many large-scale EMR conversions. Brad founded eFormatics in 2006, and today HEF is recognized as a leader in solving the problem of healthcare data isolation. Thanks, Brad, for joining us today and for sharing your insights and your expertise.
Thanks, Daniel. Excited to be here.
Dive into how to develop your EHR strategy, replacement strategy. Maybe you can share with us some of the reasons why so many physicians and healthcare organizations are looking to make a switch in the first place.
So there's been a number of studies over the last couple of years here around why physicians and physician groups are replacing their EHRs, and what they're finding is really the main motivator behind physicians changing their EHRs is dissatisfaction, whether it be with support of their current system or potentially the functionality of their current system. And there's been some items in the news lately about really the first generation EHRs and how they really aren't sufficient for the current needs of the providers. And people are saying that those are really some of the more simple EHRs that are out there are really sort of just glorified word processors. So physicians are really looking to move to more and more innovative EHR systems that can meet their needs. Obviously there's other reasons why physicians are changing, such as acquisitions or maybe looking to move to a meaningful use certified systems. And also recently we're seeing a shift of organizations wanting to take their healthcare systems and consolidate them into a single streamlined system, which is also another driver there of physicians looking to change EHRs.
Well, those definitely sound like very good reasons, and what I'm familiar with and I've heard, so that sounds pretty good. So as an organization develops their EHR replacement strategy, what would you say are some of the areas that are key considerations for them to think through?
Yeah, I think really the first area to think about is deciding whether an EHR replacement is the right decision. So how do you know that performing an EHR replacement and moving to a new EHR, how do you know it's going to be greener on the other side? So and how do you know that the EHR that you're looking to go to is the right EHR for you to be moving to? So I'm going to talk a little bit about that area in a minute here. But some other areas that you need to think about is really the financial perspective and some of the challenges around the financial sides of things. Being that given that you are going to be leaving an old system behind and investing money in a new system here, you need to kind of think through that. From the legal perspective, there's really, the state mandates you to retain your information for a period of time, and I'll talk a little bit about that and some of the things you need to think about there. Your organization is going through a change here, and people are often resistant to change. So there's some things you need to think about in terms of organizational change management, getting everybody on board, and getting buy-in into the EHR replacement that you're going to be undertaking. And then finally, the data migration. So I mentioned there's legal requirements to retain that data. So from a data migration perspective, what are your different options there? What do you need to consider when you're performing an EHR replacement? And that's actually our main area of expertise at Health eFormatics, is we do perform the data migration portions.
Okay, great. Well, let's look at each of those areas in a little bit more detail. With the first bullet point that you brought up there, how can healthcare organizations or physician groups be sure that they're making the right decision?
Yeah, I think what's of critical importance is to really define up front what are your objectives. Are you looking to improve the functionality of your EHR? Are you looking to attest for meaningful use? Are you looking to potentially save some money? And really defining what those objectives are so everybody's on the same page with what you're trying to achieve there, and what's your criteria for success in your EHR replacement. So really outlining those things, outlining also really the pros and cons of your current system. So what are the features or things that you like about your current system, and what are the areas that you're looking to improve on, and what are the cons that you have with that current system, so you know that whatever EHR that you're looking to replace it with, it should address all of those cons that you have listed there. What's really important too is doing due diligence on the target system that you're looking to move to. A lot of times you'll see EHRs that potentially, well, I guess what you really want to make sure of is that they do work as advertised. So you want to see that functionality actually work. Make the EHR vendor show you that functionality that you're looking for. And definitely talk to referrals that they give you who use that particular EHR. Ask them how the functionality that you're interested in, how usable it is, how well it works, and also ask them about how their replacement went. What were the challenges, or what were the issues that they had with it? Was it a smooth conversion? How has the support been of the new EHR vendor there? So really talk to them, gather as much information as you can about your switch, or about the EHR that you're looking to switch to, and hopefully you can get a positive feedback from them and have a good feeling about the EHR that you're deciding to go with. So
it sounds like this is probably a step that is makes a lot of sense. It's pretty intuitive, but probably one that gets skipped over quite a bit.
Sure, sure. Yeah, I mean, you have, and it doesn't take that much, just a little bit of due diligence there in terms of talking to the right, reaching out to people, talking to them, getting their feedback, so that you can make sure that you are comfortable with the EHR that you're moving to.
Okay, great. So once an organization has decided that making the EHR switch is the right move for them, can you tell us a little bit more about the financial considerations that they'd have to take a closer look at?
Yeah. I think really the first hurdle to get over is the fact that you're going to have to recognize that the money and time and investments that you have in your current EHR is going to be a sunk cost. And that's kind of hard for a lot of folks to recognize. That it is time to move on. The current EHR is not giving them the functionality that they need, and so there's you're going to have to recognize that those are sunk costs there. In terms of the full financial picture there, you want to make sure that you have an understanding of the total cost of ownership. Not only are you buying an EHR here. You have to take into consideration the data migration portion, and you're going to have training and implementation of the EHR within your environment there, and obviously you're going to have some ongoing support and maintenance. So you really just want to make sure that you have an understanding of that total cost of ownership, and also have an understanding of the ROI that you're looking to achieve. What are the ways that this move or this switch is going to help you decrease costs or potentially save your organization time and money?
Great. So I'm sure in your experiences you've come across or you've gotten pretty well acquainted with legal challenges as well. So maybe you can spend a little more time in this area, as it's obviously regulation and legal is a pretty big consideration for organizations.
Yeah, this is an area we're very familiar with because it really revolves around the legacy data, and us being involved in performing the migrations, we're responsible for taking that data and finding the appropriate home for it as you switch your EHRs. So. State law requires you to retain your EHR data for 7 years for adults or up to 21 years for pediatric patients. So you need to make sure that you find a home for that data where the data is going to be accessible and you can produce it sort of as needed going forward. You also need to think about what constitutes that full legal record. So having an understanding of, okay, this is the data that I need to make sure that I retain access to going forward. Where am I going to place that data? Am I going to place it in my new EHR system? Am I going to place it in a legacy archive there? And really sort of plan out the strategy behind your legacy data there. As I mentioned, not only does it have to be accessible, but you need to make sure that it's easily accessible, not only from a legal perspective, but also from a clinical perspective, making sure that your providers aren't logging into several different systems or several different legacy systems there to access a patient's information. So you want to make sure that you maintain that easy access so that you can have a appropriate continuity of care for the patient.
Okay, great. And I know there's probably a lot of organizations that everything runs very smoothly and everyone gets along very well, change is readily accepted. But for the few organizations where that's not the reality, what could you say about considerations around change management?
Yeah, this is obviously a big undertaking. Not a big undertaking. It's a big change for the organization. So, you want to make sure that you establish a leadership team here so that you do have full representation from each of the individual areas and departments. That you have executive sponsorship. and also that you're able to generate, clinician buy-in to the change here. You want everybody on board with recognizing that this is the right move for your organizations, and that everybody has an understanding of why. In terms of the concern from physicians, this is obviously a big change for them as it impacts their daily lives. And they're going to have concerns over their legacy data. How is that data going to be brought forward so that they don't lose 5 to 10 years worth of data in their current EHR. So, part of sort of getting their buy-in is explaining to them that they are going to be able to maintain their access to that data and how that's going to work. And also from an organizational perspective is the training and implementation. And the training of staff is something that is going to take time and needs to be thought through. So that's another thing that you're going to have to think about, how that's going to occur within your organization and the timing of that, and making sure that they get an appropriate level of training prior to go live, so that you don't end up with too many hiccups when you do make the switch.
Okay. Oh, sorry there. So data migration, as I said in the beginning of the webinar here, this is an area of expertise for Health eFormatics. So yeah, definitely share with us some of the challenges around data migration, the things to watch out for, and things that we definitely would want to be able to consider.
Yeah. Yeah, there's a number of things to talk about there, and the data migration is really critical that you're able to do this well and that it's done right. As sort of the from a physician's perspective, the success of the data migration is going to be perceived as critical, and they'll probably identify the conversion as successful on the result of the data migration, success of the data migration. So some things to think about there are, the quality of the data in the current EHR, it may not really be what an end user may think it is, where you may think that you've got a lot of coded data out there within your current system. That may not be the case, and you may, within your old system there, it may be storing it as free text or as a document or whatever. So you really need to evaluate the quality of that data within your source system there to make sure that it's going to come over nicely into your target system. There's been a lot of talk over the last couple of years about interoperability. And although there has definitely been some strides in that area, there's still definitely a lack of sufficient interoperability out there. In the CCD method, it definitely, most of the EHR vendors currently are allowing for that in some form, but it's usually not enough to be sufficient for the entire migration. So you're going to have to to deal with that lack of interoperability that's out there. When you're doing a migration as well, you're dealing with two different systems, two different EHR systems here, and there's going to inevitably be discrepancies between the systems. So you may have certain fields that exist within one EHR that don't exist within the other EHR. So you need to really think through the appropriate home for that particular data, and there's a lot of things that you can do there to account for that, but it needs to be thought through ahead of time. As you're dealing with more and more cloud-hosted systems or systems that are third-party hosted, you're dealing with data. If you're going to perform a migration, you got to pull data out of those systems, which are not potentially within your network. So recognizing, what is either your ability to access that data, or what are the capabilities of your current vendor to extract that data out of your EHR for you. You know, the migration is it involves some complexity, and so it typically requires a fair amount of expertise. You know, and that's typically not something that organizations have in-house, is the resources to and the expertise in this particular area. So you want to make sure that you pull in a sufficient level of expertise in order to do it well and make sure that it's done right. Finally here, you know, the availability of internal resources. So this migration is not something that you're just going to be able to turn over to either a conversion company or a vendor to do. There is going to have to be some involvement from the organization side in terms of, you know, really getting sign-off on the testing and making sure that the data is showing up in the appropriate location in the target system. I know something we do is we require, you know, the physicians to go in there and take a look at it prior to go live to make sure there's no surprises. You want to make sure that they have a full understanding of where their data is going to sit and how they're going to see that data, you know, once they are using the new EHR system.
So it sounds like the data migration portion, again, this is the area that you're most familiar with and your company performs here. It sounds like the data migration is not just as simple as just moving files from, you know, point A to point B.
Right. Yeah, and there's a lot of options that, and actually I'm going to talk about that in a minute. There's a lot of options that are available, and there's a number of different ways to do it. And there's a lot of different pros and cons to each of those options as well.
Yeah, before we go to the next slide, just a question for you here. So as you kind of talk through this slide, it kind of sounds like data migration, data conversions are complex in nature and complicated. Does that equate to being, does that equate to any issues in terms of the successfulness of a data conversion? Because it's
great question. You know, it's not. Yes, they are complex, but there are ways to do this and do it right. And it really, by saying it's complex, I'm not saying that it's you know, there's not a good chance of success. There's a very good chance of success with the data migration portion. It just needs to be done right, and it needs to be, you know, and you want to make sure that you're getting the result that you're looking for. So definitely, you know, it's not that it can't be done effectively. It certainly can. It just really takes the appropriate level of expertise there to do it.
Great. So you mentioned just a second ago about different options, and I'm sure many folks may not be aware that there are multiple options available for data migration. So can you touch on some of these?
Yeah. You know, there's probably, I think I have listed 6 different options here, and actually the first one's not even really an option for data migration. It's really just, you know, if folks want to leave their old EHR up and running. Definitely not ideal, but some organizations do it. You know, and with that, obviously, you're going to have ongoing support and maintenance and licensing costs, and physicians are going to have to go and log into that the old system there for their information. So, you know, you'll likely have a lot of disgruntled physicians if that's what you end up doing. You know, the second option listed here is manual entry, or screen scraping is also another route that folks go, and that's really just entering the information, you know, into the system, perhaps, you know, the day that the patient has an appointment or whatever, and entering that information in there. Obviously very prone to error, it's not automated, and so definitely not a solution that we recommend. These last 4 here are really areas that we do, or options that we do provide for our customers. And the first one listed here is the discrete data migration. And this is where you're, you know, actually putting the data, extracting all the data out of your source system, you're mapping to the appropriate location in the target system, and then you're importing your data into that system. So when the physician logs into their new EHR, all their data is going to be presented to them. So it's a wonderful solution, and when done right, it's definitely the most beneficial solution out there. Some other routes that folks go is creating some summary reports where you may have problems lists or allergies lists or whatever. Or potentially, one document per patient. It's really just a snapshot of their old system. There's a big downside to that is your data is no longer discrete, and you can no longer report on that information. So it's really a route that we don't recommend, but for some folks it is sufficient. This next one, this legacy EHR data archive, this is where you can take all your data from your current EHR, put it into an archive solution, and make that accessible from the EHR that you're moving to. So you may not have that data within your new system, but it's accessible with a single click from your new system there. So that you can pull up all that information, and typically with a legacy EHR data archive, your data is going to remain discrete, so you can continue to report on that information, and it's also easily accessible. So it's actually a very nice solution. And the solution that we typically provide for most of our customers is actually a hybrid solution of discrete and legacy. Discrete data conversion in a legacy archive, where a lot of our customers will decide to move what they consider to be critical clinical modules such as allergies and problems and medication, perhaps immunizations, and put that data into their new system so that they can get allergy reminders and drug interaction checking, that they can get that functionality on that data, and then maybe they'll put everything else into a legacy data archive so that they can turn off their old system and meet the state requirements of maintaining all of their data.
Well, that sounds good. So just to make sure that I understood, that legacy EHR data archive, that's an option where the physician group can actually turn off their old EMR, and they're taking that data and putting into, is it like a digital Iron Mountain kind of repository? Is that what it kind of serves as?
Sure, yeah. Basically, you're taking that information, you're extracting it out through queries and placing it into a database that can then be used for whatever purposes you want, whether it's reporting or maybe at some point later in time you do decide you want to bring that information into your new system. It's there for you, and that way you don't have to pay the ongoing support and maintenance costs.
Gotcha. Okay. Well, that definitely sounds good. So it sounds like there are quite a few things to be considered in the data migration strategy. So if you were to kind of highlight some of the key factors, what would you recommend those key factors to be as a part of the data migration strategy?
Yeah, I think the first one is really making sure that there's agreement in terms of what your requirements are for your data migration. Are you going to have to move the data discretely into your target system? And also getting an understanding of the capabilities of what the new EHR that you're moving to can import into their system. What are their import capabilities, and how robust is their import process to migrating your data effectively into it? I briefly talked about each of the individual options there, and there's actually there's a lot more pros and cons than I just mentioned in that couple of minutes there. But you really want to make sure that you do understand the pros and cons of each of those options there, and understand how each of those different options can impact the overall cost of your data migration. And then also, obviously, given that there different efforts are involved with each of those, you want to understand how that may impact your timeline. Obviously, part of the strategy you're putting together here is going to have to You're going to be creating a timeline, so understanding that whatever options that you're choosing line up nicely with your overall timeline for your project.
That sounds great. So just to recap, the areas that you've highlighted that we'd want to incorporate as part of the EHR replacement strategy include first making sure that the EHR replacement is the right decision for our organization. And second, the areas of financial consideration and legal consideration that you went over. And also the organizational change management, ensuring that the stakeholders are involved and sponsors are involved in supporting the change. And then finally, having a data migration strategy to account for bringing that legacy data into the new system.
Right. Yeah, I think that all of those need to be part of your strategy. So when you're putting your strategy together, really making sure that you've addressed each of these individual areas and that you're aware of all of the challenges that exist within those particular areas, and really doing your due diligence to make sure that your EHR replacement is successful. It's an important endeavor that your organization will be going through, and it's not something that you want to have to do very often. So you want to make sure that it's done well, that you are moving to an EHR that you're going to be happy with, hopefully for a long time, and hopefully this is these areas, or hopefully this webinar provides you with some direction in terms of how to get that done right.
Good. Great. Well, thank you, Brad. We definitely appreciate that, and we'll open it up to questions now. Looks like we've got a couple questions that have come in, so definitely feel free to go ahead and submit your questions, and we'll get those answered here. So let's see, the first question, let me read this here. So how do EHR replacements differ for smaller practices as compared to larger ones?
That's a good question. I think a lot of the challenges, or really all of the challenges that I just spoke about, are going to apply for smaller organizations as well as larger organizations, but maybe on a smaller scale. Obviously, with a smaller organization, you don't have as many departments and people to work with there in terms of the change management side of the house. From the data migration side of things, you are dealing with, or a similar effort is required for the smaller organizations as well. And one of the ways that we address that when we're working with smaller organizations is to provide, customized solutions for them, and really make sure that they're getting the appropriate solution for their budget and timeline.
Okay, great. We have a second question here. What are the challenges of moving from an in-house EHR to a cloud-based one?
Really, there's no real difference there. Whether you're moving from an in-house system to a cloud-based system, or whether you're moving from a cloud-based system to a cloud-based system. What's important is that you're able to get the data out of your EHR, and if you are going from a cloud-based system, you do have the additional challenge there of knowing or figuring out how you're going to get that data out of there, given that it's not within your network. But we've had a lot of success migrating in-house systems over to cloud-based systems. A lot of the cloud-based systems that are out there right now have some pretty robust import procedures and capabilities. As more and more people are moving to cloud-based systems, they've sort of developed those import processes, and can be done. You can typically move quite a bit of data into those particular systems. So I'd really say there's no real difference or reason to not consider doing something like that.
Okay. Let's see. Okay, if there's any other questions, go ahead and feel free to submit them. And if we don't get them answered here, we can include those answers as a part of both the slide deck and the audio version of today's webinar. So with that, thank you everyone for joining. If you have any specific questions about your organization, feel free to contact Brad directly. There's his email address there, brad.benson@healthyformatics.com. And once again, thank you all for joining, and have a good rest of your day.